Good morning, thank you. Arundel County Council members and fellow Marylanders. I am honored to speak to you this morning. My name is Dr. David Marcosi. I'm a professor of emergency medicine at the University of Maryland School of Medicine, a colonel in the U.S. Army Reserves, and for the last 2 years, I've served as the University of Maryland Baltimore, University of Maryland Medical System COVID-19 Incident Commander. Proudly serving Anne Arundel County and a premier hospital within our system, the Baltimore Washington Medical Center was caring for 119 COVID positive patients, of which 20 of those patients were in intensive care and 20% of those patients were in intensive care and 25% of those patients were on life support. That means that BWMC actually needed to open up additional ICU space to care for critically ill patients. Here are two important facts. 95% of those 119 individuals were not fully vaccinated with a booster, and 75% of those patients requiring intensive care had chosen not to receive vaccination at all. When we see a fellow Marylander in the ICU on a ventilator because they chose not to get vaccinated, it breaks our heart for them, their family, and their children. I want to be very clear on this. Hospitalization from COVID-19 is largely now a preventable problem if you get fully vaccinated, which includes getting a booster. Unfortunately, we believe that things will become more challenging, not less, over the next few weeks. The majority of cases in our health system are the Omicron variant. It transmits exceedingly easily between us, and although it is milder in some individuals, it is still causing severe illness in others. BWMC is doing everything in its power and is using all available staff and resources to care for the surge of patients in their hospital. Unfortunately, on December 27th, BWMC needed to declare a hospital disaster and implement crisis standard of care protocols due to the overwhelming number of patients needing care. These protocols are in place right now. What that means is this is not just a COVID-19 problem anymore. Patients suffering from COVID-19 are limiting our ability to care for many other illnesses and surgical problems too, from broken ankles to asthma to heart problems. This is absolutely an avoidable situation. I want to be sure we take a moment to recognize the nurses, therapists, doctors, pharmacists, paramedics, and essential workers in Anne Arundel County who have demonstrated unyielding determination and selfless service throughout this crisis. They are true heroes. All Maryland hospitals across the state, and especially within our county, are doing everything they can to care for us through this pandemic. Unfortunately, health providers are increasingly frustrated and fatigued, having been in this fight for nearly 2 years, and feel that many of us are fighting against them, not with them. They are nearing a breaking point, and most of them are exhausted, and some are leaving healthcare altogether. If you visit an emergency department for care, remember to have patience with your caregivers. Theirs and my request is simple. Fight with us. Simple things can slow the spread of COVID and will help us get through the next few difficult weeks. We need to all, number one, get vaccinated for COVID and flu. These vaccines are safe and doing exactly what they are designed to do, keep us from becoming sick and dying. That said, even if vaccinated, you can still carry and transmit COVID to a family member or while you are out and about at the supermarket, at church, or at work. We need to continue to own the responsibility to protect each other and ourselves even after vaccination. Second, wear well-fitting masks over your nose and mouth in public indoor spaces, regardless of vaccination status. If you're concerned or high risk, use a KN95 or N95 mask as they afford you greater protection. The CDC clearly states this, and interestingly, in 2021, a study published in the American Journal of Medicine by Dr. Zach Desmond looked at the effects of mask wearing in Maryland that actually weren't related to COVID. The study found that in our state, an increase in the prevalence of community masking was also associated with a decrease in emergency department visits for non-COVID related viral illnesses, and also a decrease in exacerbations of asthma and chronic obstructive pulmonary disease. Lastly, get tested for COVID-19 if you have had contact with symptoms who is positive, or if you have any COVID-19 symptoms, and stay home if you're having any of those symptoms. I want to wish you and your families the very best this new year. Thank you for the opportunity to speak this morning.
Thank you very much, Dr. Marcosi, and thank you for your service. Next, we have Dr. Goodwin Vanema.
Good morning, everyone, and thank you for the opportunity to speak with you today. It's an honor and a privilege to be here to help you think through the policies that you're evaluating this morning. My name is Dr. Tenor Venema, and I am a research scientist and professor at the Johns Hopkins Center for Health Security. I co-chaired the Healthcare Worker Protection Research Program over the past 2 years on behalf of Johns Hopkins University. And I've also participated in 2 National Academy of Medicine standing committees and consensus studies looking at respiratory protection, not only for the healthcare worker, but for the public at large. Let me first start off my remarks by echoing and confirming everything that Dr. Marcosi has just reported to you. And I have several points that I would like to elaborate on as you consider moving forward with your initiatives. Later this morning, I will be spending most of today on phone calls with the Maryland Board of Nursing and the Maryland Center for the Nursing Workforce at the University of Maryland. The state of Maryland is experiencing an unprecedented nursing crisis, and we have a nursing workforce that is physically, mentally, and morally exhausted. They feel a sense of betrayal in their relationship with the public, in terms of the public not being willing to do the vaccines that we know save lives, and something as simple as masking, which is the least intrusive and most effective public health action that we can take now to stop the transmission of illness. It is so critical to maintain indoor mask mandates when we think of the children who are unable to be vaccinated, elderly, immune-compromised individuals, and those others who are at such high risk, in order to maintain the economy and daily business of school and work. An indoor mask mandate helps stop transmission of disease and allows us to maintain human contact and our activities of daily living. Beyond that, the main reasons that I ask you to consider in supporting and extending your indoor mask mandate. Again, healthcare providers are literally and figuratively at the end of their rope. They have been working nonstop for over 2 years now. And the Omicron surge is once again putting every healthcare worker in jeopardy in terms of their physical and mental health. As Dr. Marcosi said, COVID-19 hospitalizations are a preventable occurrence at this point. We can stop this with affirmative and decisive action in order to protect the health of the public, the health of those most vulnerable, and the health of our healthcare providers. We are in influenza season, and so now we are seeing complications of COVID occurring with influenza, further providing evidence to have an indoor mask mandate. And finally, I would ask you to urge caution in the information that the public is circulating that Omicron, while it may not be as severe as the Delta variant certainly was, we still do not have a full and comprehensive scientific evidence-based understanding of what the long-term impacts of having COVID-19 infection are. So this remains to be seen in the future as we study those individuals who are experiencing longer sequelae from the COVID-19 infection. So when you put all of these things together, I like to reduce science down to what is simple and makes sense. indoor mask mandates, again, work, they're effective, they're not intrusive, and I urge you to continue yours. Thank you very much.
Thank you, Dr. Vanema, and also thank you for your service. Finally, we have Dr. Barry Meisenberg.
Good morning, and thank you for the opportunity to speak to the public and to the council. I am the chair of the Department of Medicine at Luminous Health and Arundel Medical Center. I'm also the director of the Research Institute. And in those roles, I oversee most of the COVID care delivered to both outpatients and on the inpatient side. I've personally treated hundreds of people with COVID as part of our outpatient and research efforts. And I oversee the care of thousands. I've looked into the issue of mask wearing myself personally, because I like to look at the data, and because mask wearing has been challenged almost from the beginning. And as it was challenged 100 years ago during the what's known as the Great Influenza. And I can tell you, I believe the preponderance of studies show a benefit, a very significant benefit in slowing community transmission in various settings. And the key thing to remember about this Omicron, and in fact, most viral infections, is that there is a pre-symptomatic shedding period. In other words, people shed virus way before they feel badly or have any symptoms. In fact, they shed the most virus on the day before they get they get symptoms of COVID-19. So mask wearing has to be not just for sick people, it has to be universal. And it protects in both directions, protects people from inhaling viral particles and from expelling viral particles if in fact you're symptomatic or pre-symptomatic. So I support any action that will help with the uptake of mask wearing and other prevention strategies which have been mentioned, like vaccination, like physical distancing, and so on. The numbers at Luminous Health and Arundel Medical Centers are also very worrisome. 130 patients in the hospital this morning who we didn't have 2 years ago. Major expansion of bed capacity, of ICU capacity, ventilator capacity, as you all familiar with it. But what I want to say to you is that these are not just numbers that you see on the crawl of your TV screen or in the department in the county's Department of Health website. These are people with families and jobs and roles in our community that are very, very important. And everyone is a loss. Everyone who's sick and becomes sick for months, and we have many like that, and every person who dies is a loss to our community. So I share some of the frustration that you heard expressed earlier. And what I would point out is to the public is, you know, the healthcare workers have been rightly praised, I think, for their duty, for doing their duty and their duty to care. But duty to care is reciprocal, and it requires a reciprocity on the part of the public to do what they can do to both protect healthcare workers and also to reduce the severity of the illness when we can. And we know that mask wearing bends the curve. And if we bend the curve, it will slow the crisis at the hospital and allow us to deliver care to everyone who needs it, and allow us to do elective surgery and help the people who need that, and allow us to treat the heart attack patient far more promptly. So the public is the ones also being hurt by the crises at the two local hospitals. And I think we should realize that, as we said early on, we're all in this together, and mask wearing will help everyone. I just want to return to this issue of the healthcare workers, because I've been very concerned about this phenomenon that you've heard already twice discussed. And whether we call it compassion fatigue or empathy exhaustion, or frustration, what you're hearing is people who are working really, really hard in a perpetual state of crisis at some risk to themselves, or fortunately much less than we started this. But they're not seeing this reciprocity on the part of the community, because the numbers, as Dr. Marcosi said, are profound in terms of who's admitted into the hospital, in terms of unvaccinated and certainly unboosted individuals. And this can cause a hollowing out of our sense of mission. You know, most people in healthcare were attracted to the profession because they're healers. And they pride themselves in answering the call, no matter the time of night or the extent of the crisis or the severity. And it's a very uncomfortable feeling to find that sense, that commitment being eroded. And I worry about these folks long term, because that really is an identity. And although it may not be the most important aspect of this crisis, I can tell you that the men and women of these hospitals, and actually the entire healthcare workforce, because lots of people are involved in COVID care, those thousands of people are looking to the public for reciprocity, and they're looking to their leaders for leadership. And I hope that they won't be disappointed. Thank you so much. And I would just conclude with a shout out to District 5, because I've lived in District 5 for 25 years. Thank you.